Maternal and child health is still a big challenge faced in Uganda, claiming lives of women and children every day. Basing on the survey, in June 2014, Amref Health Africa implemented a project funded by Big Lottery Fund aiming at improving maternal and child health in districts of Gulu and Amuru in the northern region of Uganda. The project is aimed at empowering women to learn about maternal, newborn and child health, identify the most pressing maternal, newborn and child health problems, and at the same time to mobilize their own resources and engage the wider community and self-evaluation. This is done in a participatory learning action methodology through community-based women groups to create awareness on sexual reproductive health and strengthening referral linkages between communities and existing health facilities.
So far, we have a quite number of women groups in this sub-county, which is working under this project. We have very active women's group. We also have very active leaders of this women's group. They also try as much as possible to see that our mothers in the different villages go and deliver in the health facilities.
The major objectives of the project include focusing on improving and creating more user-friendly health services and strengthening systematic community referral services for women of reproductive age, newborns and children, to better inform policymakers and budget holders to adopt a favorable policy environment and improving resource allocation for maternal and newborn child health, increasing community awareness on maternal and newborn child health issues in the districts, and to mobilize communities to address maternal and newborn child health issues that will lead to increase in the use of health services.
This project somehow also addresses how do communities and how can communities actively participate in their own health interventions.
But what comes out conspicuously is women managing their health. When you go to these groups, when you go to the health facility, it is evident that these women are referring their fellow women to the health facilities.
Achan Naiti from Kiteng Sub-Ward is one of the group facilitators who was identified by the community and trained by Amref Health Africa. She is now coordinating 5 women groups in the sub-county. In the recent past, Amref requested the community to identify one mother to be trained as a group facilitator. I was lucky to be chosen, and I joined the team of women from other communities, and we were trained from Awaj. In line with the training that I got from Awaj, we started by identifying problems that mothers faced during pregnancy and after childbirth. Some of the challenges we discovered include malaria, abortion, retained placenta, prolonged labor pains, and breech deliveries. We started listing these problems in the order of the extent of negative impact on us, and these were selected using picture cards. We found that too much work at times causes miscarriage. At the 5th meeting, we looked at possible solutions to these problems. We asked ourselves whether or not we had the capacity to address them, and we found that we could indeed stop them.
All this has been possible because these women are empowered. It is very interesting that these are not educated mothers. These women are not educated, but because the project provided them with the information and now they are able to disseminate. And for them, they disseminate to a wider community where maybe the district health workers or the lower health workers can't reach. For them, they reach them.
We started this group when we were still in the IDP camp. When Amref came, they picked one of the group members for the training. When she returned, she started sharing what she was taught about the Min Latin project. When we saw that the project was focused on mothers and children, we thought that the money we were collecting was not enough to support our needs. So we started saving without borrowing for some time. Because of this good initiative, many people in our sub-county now know about us. And the knowledge we got from Amref has empowered us and has improved visits to the health centers and deliveries. We can now use part of this money to support members with basins, clothes for deliveries, sugar and soap to support the family. We have also realized that the training from Amref has improved our strength and our saving capacity as a group, but we still want to improve further.
This one is a physical accountability. It's a physical accountability. Does not need a paperwork accountability. The women, they can talk by themselves. They can illustrate what they have been given. So this women's group, they are doing much better because of the training we are given. When you compare this one with the paper accountability and this one the physical accountability, which one is vital? That's why now you look how they are talking. They are owning the projects.
I am not in this group because I had problems with my husband. He does not want me to be in the group with my fellow women. When the group members came to our home, I was pregnant with this child. They counseled and educated me together with my husband. This changed his attitude, and we started going to the health center for antenatal care. Later, the group made follow-up visits. They advised my husband to start giving me 1,000 shillings each day, but he did not heed to their advice. The time of labor pains, I did not even have transport to the health center. The group members came to my rescue at the health center and brought me a basin for the baby clothes, sugar, soap, and other essential items. I now appeal to the group to continue giving assistance to other mothers like me whose husbands do not give them the support they need.
The achievement of this project is that it has enhanced coordination between the sub-county authorities, the health facilities, and also the Amref officials.
We are also seeing men getting involved in the affairs of the women. Husbands have started escorting their wives to health facilities because, one, they are also attending these meetings. They are caring, they are going for tests at health facilities, they are escorting their wives for delivery, they are preparing for the birth of the mothers.
Before, the level of deliveries in the health facilities was very low in the sub-county. But as I talk now, majority are now delivering in the health facilities. And I think you may hardly find a woman delivering what? At a home.
I'm now very happy and proud of my sub-county. It is now clear at the sub-county that Chitenyi Central is the only village with groups that teach women and men about maternal and child health good practices like attending antenatal care together and testing for HIV. This has enabled the group to get support from Lugore Health Center too. Our sensitization has helped them and it has made their work easy because mothers now go for antenatal care and always have delivery requirements ready.
I have attended almost 4 dialogues. During that dialogues, the women's group, they will come out with their problems and then they privatize which one is the first priority. Is it health issues? Is it maybe water and sanitations? So they rank their problems. There was one they put, also a problem of the access of the community access road. After they identified that community access road is the problems, they're saying for us we are going to dig on labor base. You sub-county, we need a culvert and technical aspect of it. Can you make that one? We do it.
Before Amref taught us, we did not have the knowledge. But now, we are able to save and to avoid maternal and neonatal deaths. We have stood out to deliver healthy babies and to deliver from health facilities not at home.
We are now seeing mothers, like yesterday I had two who came before the first trimester for antenatal care services. This one I appreciate because it came as a result of Amref's work. If they were not to come in, it was yet a problem because we have a lot of cultural beliefs here. They think a woman should come and attend antenatal care when the pregnancy is already seen. Many other things that I appreciate Amref with is also going. I told you we have had community dialogues. This one is so great to me. And out of the meetings that I've attended, women are very free. They talk very freely about the health problem that they have. And we have come with a lot of solutions to those problems. And in fact, it is helping a lot.
24-year-old Aber Sandra from Tugu village, Awach sub-county, Gulu district, has faced serious problems in her 8 years of marriage. She has lost 3 babies during delivery due to obstructed labor. All along, she had misunderstood the messages given to her by the midwife until this year, when the midwife took the initiative to follow her up at home and held meetings with her whole family. During these meetings, it was discovered that Aber was a liar who took her pregnancies for personal gain without regard for the babies or even her life. Aber realized her mistakes when her husband told the gathering about his fruitless efforts to make her life better as a mother. The health worker advised me not to deliver from this health center, but rather go to the hospital because my pelvis is narrow. She also gave the same advice to my husband to let me deliver from Gulu Hospital rather than a health center because of some complications I may face during delivery, which he accepted.
This is a methodology that can be spread to all districts in Uganda because it is cheap, it is effective, it is started by the indigenous people. You set them off and they continue. These women groups is a structure that can mobilize for health. It's a good structure that can be linked up to village health teams so that they mobilize communities for better health.